All right, looks like we are at 1 o'clock, so we will go ahead and get started. Welcome everybody to our October 2025 Get Well Wednesday. Happy fall, y'all. So glad you've joined us today. I'm Misty Avery Wilson, Director of Clinical Consulting and the Learning Center here at Get Well. We have a great presentation coming up for you all today. Get Well Stay is so versatile, right? Like you can do all the things, education, service requests, patient experience. And what our presenters today are going to do is give some great examples of how by zeroing in on a few key focus areas for improvement, their leadership and frontline teammates have been able to use Get Well in a very deliberate way to move the needle on their areas of opportunity. So before we get started, just a couple housekeeping items. Due to the size of the audience, everyone is muted. You can put any questions or comments you have in the chat throughout the presentation. The wonderful Loretta Santisi, who is our Senior Director of Client Success for the government team, is going to help me monitor the chat and answer any questions. So don't be shy. Feel free to put anything in the chat. We'll also plan to have some Q&A at the end with our presenters, time allowing, where you can raise your hand and I will try to take you off of mute. So if you are new to Get Well Wednesdays, welcome. If you have been with us before, welcome back. We host this virtual session the first Wednesday of every single month at 1 o'clock Eastern time. So it can be a lunch and learn for East Coast, brunch and learn for West Coast. Our sessions have a new topic each time. So it's a great opportunity to learn from your peers, learn from our Get Well subject matter experts. And you'll also be able to find this and all past Get Well Wednesday recordings and slide decks on the Get Well Connection Hub. So here are our next two Get Well Wednesday topics to finish out the year, which sounds crazy. So in November, we'll explore some proven strategies to boost staff and patient engagement with video education while ensuring long-term success. We'll have two facilities presenting on how they have sustained a very successful patient education workflow for over 2 years now. So that will be a great session to attend, especially if video education is one of your priority areas. December, we are going to end with a fun one. So this will be a showcase about how Spellbound AR, which is one of our vendor partners, is using augmented reality to help enhance the patient experience. So that will be a great one as well. And with that, that's enough for me. I will turn it over to our presenters today to introduce themselves. So Evilise, I will pass it to you.
Hello, everyone. My name is Ivelisse Martinez, and I am the Get Well Client Services to support facility initiatives. And I have been with Get Well and within the facility since November of 2021. Before I pass it on to my colleague Vilia to introduce herself, I would like to also recognize Ms. Ana Torres and Nancy Vasquez, who are also part of the working group that created the initiative that we will be presenting today. I will pass it on to Vilia now.
Well, hi, my name is Belia Santana. I'm the assistant nurse manager from Ward 6J. I've been working here in VA San Juan approximately 22 years. I'm also the pain champion of the facility. So um, I'm very grateful to be here with all of you today. Thank you.
All right, Tori.
Hi, everyone. My name is Tori Triplett. I'm the client service manager here in Dublin. I've been with Get Well and here at the Dublin site since November 2024 when we went live in the CLC. I'll pass it off to my co-presenter, Ms. DeLise.
Hi, my name is Tamika DeLise. I'm a retired Army Nurse Corps officer, and I'm currently a nurse manager here at the Dublin VA.
All right. Thank you, ladies. And with that, Evilise, I will go ahead and pass it back to you.
Perfect. So a little bit about our facility. The San Juan VA is part of 11 locations serving Puerto Rico and the U.S. Virgin Islands. Our healthcare system is one of the leading healthcare systems serving veterans in the VA Sunshine Healthcare Network 8. We're an innovative care center within the Veterans Integrated Service, which includes also medical centers in Florida, Georgia, and the Caribbean. Next slide. Thank you. Today, I'd like to walk you through how the San Juan VA Medical Center is leveraging the Get Well stay to improve veteran comfort and ensure that pain management remains a top priority across our facilities. Next slide. Pain management continues to be one of the most critical aspects of patient care. Patients often are facing complex medical conditions that require thoughtful, patient-centered approaches to managing discomfort. Our challenge here at the facility was very clear, and it was how do we keep every veteran's pain under control while also empowering them with the tools and education they need to advocate for themselves. Also, we wanted to set realistic goals so patients understand that while pain relief is the primary goal, complete pain elimination may not always be possible. So to meet this challenge, we introduced a custom pain management educational tile within the Get Well system. This tile includes a video and easy to understand content available in both Spanish and English. The workflow is very simple. We introduce a pain management video to the essential education lineup. And patients also receive daily prompts 3 times a day, 8 a.m., 12 p.m., and 5 p.m., encouraging them to engage with the content. Once a patient answers yes to the prompt, they access the custom page and the prompts no longer repeat. If they answer no, then the system will continue prompting at the next scheduled time until engagement happens. For convenience, the pain management tile is accessible in the My Health section for on-demand use. And like I mentioned before, it's available in both English and Spanish, addressing the needs of a diverse veteran population. And what we did was we created this tile with different tabs so patients can scroll through them. And I will pass it on to Vilia now so we can share our amazing outcomes. Next slide.
Our results speak for themselves. We have experienced sustained growth across 11 months of tracking, a 346% increase in utilization of the content, demonstrating strong alignment with patient education and care goals. Also, we have a 13.33 improvement in patient perception scores for pain management. These outcomes highlight how technology, when paired with patient-centered care, can deliver measurable improvements. This approach has brought us 3 main opportunities. Increase patient satisfaction by empowering veterans with knowledge and control. Enhance communication, helping patients and providers speak the same language about pain management. And number 3, improve outcomes as veterans learn to better manage expectations and actively participate in their care.
All right. I think we had a little bit of a delay, so that may explain some of the slides and such, but y'all did a great job. Thank you so much.
Perfectly fine.
All right, so now I will pass it over to Tamika to talk about how the Dublin VA is validating staff rounding and using that for the 6 Ps of fall prevention.
Hello again. The Carl Vinson VA Medical Center in Dublin, Georgia was commissioned as a United States Navy hospital in 1948 and was named after the longest serving member of the U.S. House of Representatives. The medical center has since grown to service over 40,000 veterans across Middle Georgia and Southern Georgia. In the CLC, Get Well went live in November 2024, and it went live in the domiciliary July 2025. Next slide, please.
And can you tell everybody what a CLC is?
The CLC is a community living center. The domiciliary is a unit that is for substance abuse, PTSD, different homelessness, different things of that nature. We have over, currently in-house right now, we have over 90 veterans being serviced by the domiciliary and 121 veterans in the CLC. The community living center is more like what you would consider long-term care. The staff rounding survey, we found a gap in care to our veterans with falls. We had an increased number above the national average. So I got with Tori and we developed the staff rounding survey. And this is how we decided to mitigate falls within the CLC. We increased bedside staff rounding. We used the 6 Ps, and this is actually how it looks when it's up on the TV. It presents just like this. And how can we increase bedside documentation and monitor hourly rounding for residents who have multiple falls? So that's why we initiated the program, because like I said, we were above the national average and we had some of the same veterans that were falling multiple times. So we wanted to be proactive and mitigate and reduce injury, of course, and keep our veterans safe. So the solution we came up with, the Dublin VA partnered with Get Well, Tori, to create a custom rounding survey on the TV that focuses on the 6 Ps. The staff are able to complete the rounding survey on the veterans TV using the pillow speaker. The Get Well is able to track the time and date each survey is completed by staff, leaving a record of when the staff are in the resident's room. So that was another issue. We wanted to make sure that the staff were going into the room hourly as they should be. So it was an accountability piece, a safety piece, and all that came together with the survey. Accessing the survey. So the survey is actually accessed through the pillow speaker. The pillow speaker is what they use, to change the channels on the TV, how they call the staff. They use it through the pillow speaker. So what they do is they come into the room, they ask the veteran for their speaker, and they let them know what they're doing, of course. They press the menu button, and then they get to the quick care tab you see here. And then they enter the hospital specific code, which is 1234. And that code is for every unit. Every unit has the same code. And then they will see the staff only tab. Then they will press on that and they will have the staff rounding survey. So this is what the survey encompasses, the 6 Ps. The first one is pain. They ask the veteran if they're in pain. The next one is potty. They ask the veteran if they need to go to the restroom, or they may need Foley care, or we may need to just check the Foley, because at times those Foleys, the tubes get kinked. So that's the time where the staff person would come in and check those things. They ask the veteran if they need any of their belongings, because we found that with some of the falls, the veterans were reaching for something, whether it be their cell phone, whether it be a book, anything, their glasses. So we asked them if their personal belongings are within reach. We also check their position. A lot of our veterans are, they're not able to move as, we would be able to, readjust ourselves as needed. So we have to assist them with those things. We have to turn veterans every 2 hours. So that's another thing that we do while we're in the room. We check pumps. The pumps could be an IV pump. It can be a feeding pump. And it can also be the bed pump, because we have pumps on our beds as well. We have air mattresses. So we check that pump and we check the IV sites. And we make sure that those things are inflated. A lot of times you'll come into a room and something's wrong with the air mattress. It may be deflated. So this is an optimal time to check that. And the last but not least, we give them a promise. We let them know that we're going to return within the next hour to do another check-in. And that's the most important part. Just letting them know and building that staff veteran rapport is very important with this process. So resident participation. What we needed to do was figure out who would be part of this program, who would we utilize. So we started out with a pilot. It didn't go so well with everyone because they didn't want us taking their pillow speaker while they're in the middle of watching their Westerns, whatever the case may be. So we decided that we wanted to kind of zero in on those who are the heightened fall risk. So we developed this criteria: new admission 72 hours. For new admissions, it's a new surroundings. We want to ensure that they're acclimating. So we kept them on for 72 hours. New falls, 72 hours. 2 or more falls within 14 days is 90 days. more than one fall in a month, 90 days, more than one fall in a quarter, 90 days. Instructions. So what we did was we gave the charge nurses instructions. Every unit, they have an assignment sheet every shift. So on that assignment sheet, we highlight those veterans that are in the program in yellow. So this lets the team know that they need to do the hourly rounding tool on those specific veterans. We assign the hourly rounding tool to those staff members who have that veteran in their assignment. So each staff person has an assignment. We complete an All About Me for the new admissions. All About Me is basically letting us know all we need to know about the veteran, how they transfer, what their MOS was in the military. It tells us about their family, their job that they had before they came into our facility. We complete a false tips. So the false tips is for the veteran. It gives them tips on how to move around their unit or move around their room, mitigating those falls from happening, whether it be shoes, socks, ensuring that they, stand firm. All those tips are on that board in their eyesight, line of sight. And then we add the veteran to our watch list huddle. So the watch list huddle is completed Q shift. It's with all the team, it's interdisciplinary, and we add all those veterans who are of a higher acuity to the watch list huddle, as well as those that are on our fall reduction program. So I'll pass it to Tori. You have the torch.
Thank you, Tamika. Yeah, so now I'll discuss some of the outcomes. Some of the outcomes or benefits of purposeful rounding and bedside documentation include reducing errors, delivering real-time information. This also helps with decision-making of care, improves efficiency and teamwork, as well as Tamika said, enhances that patient satisfaction and building that rapport. It also reduces anxiety from patients or veterans not knowing when staff are coming, and also enhances patient safety and identifying those early potential risks. So our primary focus areas were, of course, quality and safety, trying to reduce falls, improving patient experience, and also operational efficiencies. Next slide, please. So this is just a sample data. One of our outcomes is just being able to have that validation of hourly rounding is done. So as you can see here with the data, we will receive that time and date that the survey was started and completed. Usually based on the data, it takes staff like a minute to complete the survey on the TVs. And by then we're also able to get a real-time snapshot of what was actually done. Like what did they do while they was there? Did they assist with toileting? And just also being able to validate and have that record to go back and see, was this actually done hourly like it was supposed to? So before this, there was no way to actually prove that staff were in the room. Next slide, please. We saw an increase in bedside documentation. So keep in mind, guys, we just started this program in June of this year. So these are great outcomes just to start with. So in June, we had 267 surveys completed. July, there was 409 surveys completed. And then in August, there were 1,222 surveys completed for that month. So bedside documentation increased by almost 200% in August. And the importance of this is just that real-time documentation at the point of care reduces delayed documentation errors, also improves patient safety and helps with decision-making. We also saw an improvement in patient satisfaction. So we have the staff responsiveness prompt appear on the Veterans TV weekly on Wednesdays at 11 a.m. So every Wednesday at 11, a prompt will appear and it will ask them, when you need help, does your care team respond quickly? And the veteran can respond yes, no, or I don't know to that prompt. So in May, that was kind of our baseline. There were 11 no responses in May. And then as we can see in June, that decreased to 2 no responses. So that's when we went live with actually completing the staff rounding survey. And then in August, there was only 1 resident who responded that their staff did not come quickly when they pressed their nurse call light. So that was a 90% decrease in no responses since starting the program in June. So that means that patient satisfaction improved as a result of proactive rounding. And so for fall reduction, when we went live with the program in June, we saw a 66% reduction in the total amount of falls. So that average amount of falls for the CLC was 13. And then in May, there was 11 falls. So the falls dropped from 11 falls to 4 falls in total for the month of June for the CLC. In July, there were 0 falls reported from residents on the program in July, which is great. Some of the barriers we've had, like Ms. Delise mentioned, some of the residents have complained about staff coming in using their pillow speakers or call lights at night to complete the rounding surveys. And it can be disruptive if the pillow speaker, if they're laying on it or it's near their bed, so they, kind of have to get it, and that could wake the residents up. So a solution to that will be having a couple of Get Well universal remotes on each unit so that staff can go in and complete the survey without actually having to be near the bed and being disruptive.
All right. Well, thank you, Tori and Tamika. That is all great information. And I know you just started this program, so we will probably check back in down the road and see how it's went over some time. So well, we actually have time for Q&A now. So everybody is muted, but if you raise your hand and you have a question or a comment, happy to take you off of mute so you can ask directly.
Hey, Misty, we have a few questions that came in through the
Oh,
chat,
sure. Yeah.
if you don't mind. So, one question by Miss Lisa Jones is, when you complete the tips in the CLC, how do you display it to keep it within the home-like environment? I guess that's to you, Tamika.
Well, prior to us displaying the tips, we met with the Residents Council. So that's the veterans who, currently live in a CLC. And we got their permission to post, to put up those false tips. And with that being said, we laminated them, kept them in a good size, not too large. That was one of the things that the veterans asked us not to make them too large. And it keeps it a home-like environment because we posted up there with the All About Me. The All About Me we have like it's like the size of a picture, 8x10. It's all about me. It talks about the veteran, and it's posted right under there on their closets. And the veterans seem to be okay with it, and it's also within their line of sight where they can get those tips. So that's pretty much how we keep it a home-like environment. And most of our veterans are in a room by themselves. So we only have maybe 2 or maybe 4 rooms that have dual occupancy. So we haven't had any issues with it being a home-like environment for the veterans because of the way we posted up on the closet with that All About Me form.
Great, thank you.
Yes, ma'am.
The next question is, where do the patient satisfaction surveys sent to, and how often are the responses reviewed? So Tori, I don't know if you want to address that. Tori.
Is this the staff responsiveness survey? I'm thinking it's about the staff responsiveness prompt, right?
I think
yes.
Yeah, so that appears on the residents TV. So it's every neighborhood and every unit in the CLC will get that prompt weekly on Wednesdays at 11 a.m. And so we can see the data in real time when it's submitted. It's in management console, what we use to go in and check the data. And so we can see that, but I present that data to the nurse managers monthly. So that's how they're able to see that in a monthly report. But if they have any questions or want to see it in real time, I can pull that information for them.
Okay, great. So if remotes are not being utilized at a particular facility, can the patients use the pillow speakers, or do they use mobile remote? I think the answer could be both. They could use their pillow speakers and or mobile remote.
Yes, if it's to complete the survey, as long as the survey is not like a third-party site and it's on actual Get Well, they can use the mobile remote.
Mm-hmm. And then there was last question that I got in was, is the 6Ps documentation in the platform being implemented only in the CLC and DOM, or is it also being implemented in acute care?
It hasn't been implemented in acute care as of yet. There has been some conversation with the acute care nurse manager, and we're looking into that. But as of right now, we're focusing on the CLC with the increase in falls. But hopefully, we look forward to meeting with the ADPCS soon to get it implemented throughout the whole facility.
All right, perfect. Well, we only have a couple of minutes left. Did anybody have any other questions? They might want me to take them off of mute to ask. Okay, you should be able to talk now.
Okay, can you hear me?
Yes.
All right, great. So just and it may have been addressed, I just may not have caught it, but like for those residents who are included in the hourly rounding, what was the compliance really with then your results from Get Well? Or I know that documentation increased quite a bit, but like, did I miss the compliance with, those that are required for the rounding and the just the compliance to that? And if you had issues with that, I guess how you addressed them.
As far as compliance, there were some barriers as far as getting everyone educated and ensuring that initially, like I said, we piloted on one of the smaller units, just to see how it would go. And that's how we worked out those barriers. We found out what concerns the veterans had. So we worked through those things, and then we implemented it throughout the whole CLC. We are still having some barriers with some of the staff sticking to the criteria. So what we're currently doing for that is we're going out and reiterating what the criteria is, the importance of the program. The most important part when you're dealing with staff and is getting their buy-in, getting their understanding as to why we're doing what we're doing. And that's why we're going back out to reiterate and hopefully revigorate some of their buy-in for this program. So that is one of the barriers, getting everyone to follow through with the program. Like, we may have an admission and they're on for 72 hours, and the first day they didn't do the hourly rounding tool. We're finding that. So in those instances, we try to keep up with their missions, so I can remind that manager, hey, make sure your staff complete the hourly rounding tool, so we don't have veterans that are, falling the first 72 hours into the facility. So it's taking some work. Of course, it's taking work. But hey, it's a culture shift. It's a learning curve. And I believe in this program, and the numbers speak for themselves. So I'm going to continue to work hard to ensure that we're all doing what we need to do with fall reduction.
Thank you for that. Great response and great project. Yes. Kudos. Yeah.
Very, very well said. Well, we are a minute over. I just wanted to call attention. Ambassador Program Training is coming up. This is a 2-hour virtual session. For you nurses, you can actually get 2 continuing education credits if you attend. So we got some QR codes here. You can also register on the Get Well Connection Hub at any time. And you will get a survey when we close this webinar. If we did not get to your question or you think of a question, just put it in that survey and I will make sure we get back to you. So thanks everybody for attending, and I will see you in November. Bye.